I'm Dr. Marsha Sanity,
And I'm Dr. Caleb Moore.
and this is
The Free Smiles Podcast. Today we are discussing associateship opportunities, some of the red flags to look out for, and what aspects of that opportunity feel great.
Yeah, I think this is one of the almost like most moments when you're deciding like what office to work for. Like there's so much emotion that goes into that, but also almost like you feel like all these decisions like are going to be like the end. Like, oh my gosh, I don't choose the right this or that. But it's really just going through it in a stepwise fashion, which I think kind of the information that we're going to talk about today is like a stepwise way to be like, hey, how do I look at an office? How do I decide yes or no, or what am I going to be asking them when I'm first even just talking to them? Not even talking about a contract yet. Just what am I looking at the office?
Yeah, and what makes you feel comfortable along the way to say, yes, I want to join the team and I want to be a part of that practice, and what things that you can read and pick up on throughout that process to be like, hey, maybe that doesn't feel great to me. And starting an associateship, it doesn't have to be the end all for you. This is this could be the beginning of your career, or it could be a new opportunity into a new environment for you. So there's a lot of exciting moments that go into that, and but there can be, like you said, it's emotional. There are a lot of emotions that go into that as well, and making sure that you're making informed decisions in that.
Yep. I think part of that starts with just really aligning with your own just values. Like what's important to me as a provider, and how do I want to see my days work out? How do I want to live my life for the next usually minimum year? Because that's the average contract that you're going to be in is like a year long, maybe two. And like what is it about that office that is interesting to you, or that does be like, oh, I'm excited about this or that? Like what does that mean in your perspective? Because that's something different for everyone.
Yeah. And what is their vision, for the practice? Are all of the team members aligned with that vision, and how are they taking care of people, and how will the addition of you into that team, how's that going to feel for you and for them?
Yeah, and I think it's such a top-down thing. So I always think of each, even if a dental practice is part of like a bigger group, each dental practice is its own like ecosystem. So I feel like there's this almost like energy that each office has, and it comes from the top down. So if you have a certain like cattiness or a drama or something like amongst like your assistants in the practice, or the hygienists are a certain way, or your front office is kind of at tips with someone else in the, like that usually comes from the top. It comes from the doctor that's leading that practice,
right?
Or some part of like the leadership is allowing those kind of little things that just build up over time to create like a non, I shouldn't want to say toxic environment, but like some kind of environment that's not making like work feel just like work. It's feeling like you're walking into like a soap opera,
right?
Like.
And I think, those aren't things that you're going to recognize immediately, So let's walk through the process of when you are considering that associateship. This office looks great. What's the first thing that you're looking for?
Yeah, so I think the first thing, and I kind of relate a little bit of my hygiene experience to this, because whenever I would just walk into an office or, just check them out, I want to know, how long has that office been established for? How long have they been seeing patients? How long has that doctor been working at that practice? Same thing with their team. Is there a high turnover rate in your team? Do you have new hygienists every few months? Do you have new assistants every few months? Can you not keep a team? I think COVID was a weird time where that really fluctuated a lot more for people. So Absolutely. I would kind of give a little bit of a grace period coming out of that. I'm seeing a lot more things stabilize when it comes to not so much turbulence and not so many people like leaving dentistry, which really was a huge thing coming out of that time. But I think now things are more stable. It's a little bit easier to really almost like feel out how that practice is. So I think the biggest things I look for are, like how long has that doctor been there for? Have they been through a bunch of different associates? Can they not keep an associate? And why, in their words, do they see that turnover happen? Even if it does, because you're going to get some turnover. People are going to move, things happen. But if it's pretty regularly, if no one's in line and everyone's learning something new every few months, that might be something what we call like a red flag to that practice. Like what's the fundamentals that aren't in structure here that are going to affect my day?
Yeah. And why is that, that office and that doctor looking for an associate? What is the reason? Why did the previous associate leave? And how does the doctor feel about adding you to the team? What are they going to provide for you as well?
That's huge. I think it's interesting because you're like, yeah, like they obviously are looking for an associate. So it's almost like you assume, oh, they're here to bring success to me as well, which a lot of people are. A lot of people don't want to bring someone on unless they're also going to be successful and happy. But surprisingly, there's owners or practice managers who sometimes take over that part and they don't really think about that. They think about, oh, we're just getting a doctor in here. These are the numbers. This is what I need. I need a body. Which, like that's like, okay, a little bit of, some nuance to that. But I think if you're truly with someone who like wants to bring you on and be like, hey, I'm getting older. I don't want to take on as many hours at my office, but I have established this patient set who's also comfortable seeing another doctor.
Right.
That's a huge part of it. If you're coming into a long established practice, which can be a great benefit because they don't have a huge issue with having new patients, they have internal referrals, like they're just kind of going and their new patient numbers are great to support you as an associate, especially if a doctor's leaving, but they also need to support you with that transition. Like I've noticed as a hygienist seeing different doctor, interactions, but also as an associate at a different kinds of practices, like some offices I stepped into, it was like, they were really almost like fixated on that one doctor. And there wasn't support to be like, hey, I want you to take X amount of exams every day. It was like, oh, you're only going to get these couple new patients that we kind of have room for, but not really. Where then I transitioned into an office, and I didn't even notice this until I was not at that office anymore, was as I transitioned into a new office that was there to support me. And I didn't really know what that was like until I was there. It was like, hey, I'm here to support you. I'm the owner, but now I'm taking only these couple of significant patients. The rest of the patients, I'm dividing them up between you and the other associate. The other associate has been there for X amount of time. They want me to take over their patients. Like, it was just very collaborative, and every day I'd be seeing 50% of the exams instead of being like, oh, I'm seeing 2 patients a day for exams.
And I think an important aspect of that you mentioned was the endorsement, the support, the mentorship, and the endorsement. There has to be a process. There's a period of time where the doctor that you are, that is mentoring you needs to ensure that your philosophies and the way that you are treating these patients is in alignment with the way that they were doing things, having your own autonomy, but making sure that there is alignment there, and then endorsing you, mentioning your name to the patients, telling them how amazing you are and how excited they are to have you on the team, and that, your philosophies are aligned, so then that sets you up for success moving into that role.
Yeah, and I think, and that's just so huge. Like there's so many ways to do that, but I think you'll see it. Like you'll notice if when you're coming on into that first interview, maybe it's a 2-interview process, or maybe they're taking their time to find a new associate. Maybe they've been looking for a couple of years, not because they can't find people. Maybe they've interviewed 100 candidates, but they're like, we really are taking our time to find the right doctor versus, oh, we've been looking for a month. You're the second person to apply.
Yeah.
Again, that like you're a warm body that we can put in the chair kind of a thing. So there's that huge difference between we're taking our time to find someone, which almost makes you feel like, hey, we're taking that energy to find the right fit because we know we want to set you up for success.
Yeah.
Kind of a situation. And
then once I think these core values and mentorship and alignment and treatment outcomes and everything, that is the basis of where you're going. I think that once those core values aren't aligned and you feel comfortable, we need to look at office metrics, right? Just because you feel great about the doctor and you guys have the same philosophies and you're really excited for that collaborative approach, it doesn't mean that the metrics are there for you and your goals in life. So what would be some of the things that you're looking for in terms of insurance or new patients or things like that? What are you looking for?
Yeah, so I think that number changes when it comes to like new patient numbers. I think there's like a set, you should have X amount of new patients to support X amount of doctors. I don't have that exact number. But what I do know is that if I'm coming onto an office and they have 10 new patients a month, but they're also going to be increasing a budget for marketing when you come on to get X amount of patients, that's a little bit different.
Yeah.
If an office has 50 new patients a month and they're having to book new patient visits out by 3 months, that's a very different thing. So I think establishing like how long is it till your next new patient availability? And if they're saying, oh, we're booking out 3 to 4 months now because we're really getting blah, 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 we have this established templates in our hygiene thing, but now we're really surpassing that. We really need a third doctor on. This is why we need this. I think that's huge. I think the other part of that is just like you were saying, what kind of, and this is kind of going back into the contract stuff that we'll get into, but what types of insurances are you in network with? Right. Are you expected to be in network with all of the insurers that they're in network with, or is there just one that they're in network with and that's a negotiated fee? I think talking about negotiated fees is important, and I don't want to get into the weeds of this too much because it's kind of like, to me it makes my eyes glaze over and I'm thinking about like insurance and numbers and coding, but it's so important because that can affect your day so much with the number of downgraded like fees, the number of how many patients you get on that contract with that insurance. And I would say most insurances, they're gonna keep fighting you. Like if you are in a practice that is heavily insurance driven, the stress that puts on your team, the stress that puts on you as a doctor, right. It is almost like an untalked about thing in dentistry where if you have one person that's dedicated just to doing insurance, that's a whole human being. That's all they do all day is fight with insurance companies. And then you have like the patient part of that is them getting like, oh, why wasn't this covered? And it's like, and then it just makes the atmosphere of like patient expectations different. So I think the insurance part of it, not that you can't go into a practice that has negotiated fees with insurances, but I think it really depends on what your expectations of what you will make at that office and how many of those procedures you'll have to do to just make your bottom line, just to pay your bills.
Yeah. And I think not only the financial aspect of, I need to do this amount of dentistry every day, but the physical and mental toll that has on your body. So really just, when we're looking at those office metrics, ensuring that the schedule is set up for success, that if they are in network with X, Y, and Z insurances, that you don't have to bounce from room to room to room all day long and feel exhausted at the end of your day. I think asking those types of questions early on in that job search is really important. And not just, looking at the overall basic contract agreements, but focusing on those nitty-gritty questions. What is my day-to-day going to be like? How am I going to be supported, and how can I support the team? What is my schedule going to look like? And are there templates for new patients in my schedule? How is that going to work in the beginning? How are we going to market me joining the practice? So asking all of those questions, I think that's really important. And then once all of those, feel comfortable, then we need to get into the contract. And what are some things that stick out to you in a contract when you're first reviewing one?
So I think the first and foremost thing is how are you being paid? Mm-hmm. And I think that's important because is it based off collections? Is it based off production? Do you have a daily minimum? Is there an end point to your daily minimum? Or do you always have a daily minimum? No matter what happens on that schedule, are you going to get paid X amount because you're there to still do exams, to still, be productive at the office, just maybe a patient fell off the schedule. So I think there's pros and cons to each of those things. I would say arguably by any doctor that I know, being paid in production is always the better of the two situations. If you're paid off collections, you're no matter what you do, your end of day, end of the line number is always going to be reflected on what is someone else doing to collect that payment from insurance, from the patient. Do they have a system set up for all those things? So, and I think asking if you are getting paid on collections, if you do like that office and you want to work for them and there's that collections part, maybe that part's negotiable. But you also have the ability to be like, hey, I want to see the numbers of what your collection rates are.
Right.
Give me, because any computer system now in dentistry will be able to give you a report in 2 minutes about the history.
Exactly. I think that's important because, when I first came out of school, the first job that I took, it was based on collections. And, just from our experience and our own research, I knew that productions was better. And I didn't negotiate for that to be changed. But I asked key questions. What is your percentage of collections? Who's in charge of doing that? What is their role? And how successful are they in doing that? So I think, asking those key questions, what are the percentages? If you are willing to pay me on production, is it adjusted production? And what do those adjustments look like as well based on the insurances that we are in network with? So I think digging a little deeper into those questions. Another aspect to focus on is what labs do you guys use? And in the contract, am I paying for those lab fees? What are the percentages? What are the crowns like that are coming back from that lab? Do I like their work? Because you may tell me that this is the lab that I have to use where I maybe pay less of a lab bill, but if I want to use a lab that I prefer to give my patient better materials or a better fit, I'm going to have to pay for those myself. And what do those fees look like? So I think that's important.
That's huge. I think that's something I didn't really think about too much when I was first getting into my original office was that part. Because I was used to being like, oh, if I have a lab or, maybe the doctors I knew that worked for this company, their work was always really good, but I didn't think about this specific practice and like what maybe things had changed. So really researching those things too. It's tough and getting to know your lab tech. So there's certain labs that if you know that you can talk to them, you have a certain person that does certain cases for you, you have good communication with them. So they know how you like things. They know what your expectation of them is, and they will do that for you.
And I think that's a really important point to make. Asking the existing doctors in the practice, what has your experience been like with these labs that may be in formulary? Do you have a good relationship with the lab tech? And is that lab tech, open to, having a conversation with me to ensure that our goals are going to align, right, and what we're looking for? And I think something that, I have found with the current associateship that I'm in, I've had a lot of autonomy in the labs that I can use. They've been really supportive, and, some of my mentors have given me, this is the contact you should talk to. One of our local labs, moving into full arch cases, I was given a recommendation for this lab, and it may not have been one that was in formulary, or that they want us to, work with in terms of, percentage and reimbursement and all of that. But at the end of the day, having the autonomy to make those decisions, and I've been really empowered to do that. And I think that's important to know that, hey, yes, this is what the contract states, that these are the labs that we want to work with, and this is what you are responsible for. But know that we have other labs that you can work with, and we're open to giving you resources, and letting you make decisions on your own.
Yeah, and I think part of that goes into, once you're kind of weeding a couple of these questions out in your initial interview or two, and then setting up, I would ask for an observation day or two before you start. So, there's one thing to sit down with someone across the room or them or their practice manager, whoever you're interviewing with. It's another thing to actually see that come to play and come into action. So if I'm really into this office, I really, I think, okay, this could be a good fit. we're driving, we have good rapport, like all those things. If I go into their practice and then I'm looking through their charts for the day. I'm talking to their hygienist. I'm talking to their assistants. I'm asking them just about how their days look. Are they stressed out? Are they not happy? Like you can pick up on just talking with someone one-on-one, just kind of in those moments. Looking at the cases that they're working on, talking. If the doctor is willing to have you in for an observation day, they should also be willing to talk to you about their cases, their outcomes. Really anything that comes along with that. So I think observation is one. There's also like a working interview, which I've never done as a doctor, but I've done that as a hygienist.
Yeah. And I think that's really important. Seeing, like you said, diving into those cases. What type of cases are you guys doing here? What are the results you're seeing? And then asking the team, how did your day go today? Observing for the whole day, circling back with your team members at the end and say, how did today feel for you? What was a highlight? Or what can you share with me about how your days are going? Anything like that, because it's going to give you insight to how the team feels, what the culture is like, even just little things about how the hygienist may come get the doctor for their exam. What does that look like? Is there communication? Are they writing things down and me being in the room? There are little things that you need to pick up on that, do you want your hygienist coming in and saying, well, Dr. Marsha, I'm ready for my exam, in the middle of communicating with another patient, ensuring that what the office is doing currently aligns with what you want when you step into that role, and that everyone feels good about their day. I think that observing is really important. I also think that there is a lot of benefit in a working interview. I think it just depends on how it's structured. So, for me, completing a working interview, you want to ensure that you're not going there and working for free, right? You want to make sure that you're compensated for that. And I think it's the verbiage, and I think it's the tone of how it's presented to you. If a doctor is telling you they want to check out your work or see how you do things, I think there needs to be some trust in the beginning and who you are as a provider. I think that if they are approaching this working interview as, we really want you to join the team, and we want to ensure that it's a good fit for you, that you and the team are going to collaborate well. Are you open to being paid to come in and do a filling or two and seeing what the process is like throughout the day? I think there's a lot of benefit in that too. It just depends on how it's being presented to you and if you're being compensated for it. All right, so you did your research, you found an office that feels great, the culture and core values align, the office metrics feel really good, and they hand you this contract. Where do you go from here?
I think knowing that we're not lawyers,
Mm-hmm.
there are wording and all those little nuances in contracts, and there's subcategories and all these little things that I personally hate to read.
Yeah.
I'm definitely going to read those things, but I'm also going to possibly either hire someone private, so hire a private lawyer who does contract review.
Mm-hmm.
The nice thing is when you're first getting out of dental school, I think it's a great opportunity to look at, do you have a law school in your university?
Mm-hmm.
Do you have a local law school, or it may be a law firm that takes on like pro bono cases or something like that, or they're able to review your case for either $0. So
Right.
A law student is more likely going to be able to offer their services for a lower price or for free. I think at our school, they did offer, in conjunction of our university, said, hey, as you're getting out of school, we offer free contract through our law school. And I think that's great. I think that's an awesome thing that every single dental student or even medical student should look into, should utilize. Even if you're like, okay, it's fine, I'm signing this contract anyways. Like, I think it's important to understand, because as much as that office might be a good fit for you, there might be changes in 6 months. There might be in a year from now, you might have changes in your life that, oh, I need to move, or this happened with my spouse, so I need to change what I'm doing in my life, or I need to move my office. All those things can happen, and it's the unknown that you're planning for. It's not the known things that you're planning for.
Exactly.
Yeah.
And I think when I was first reviewing my first associateship contract that I was given, I had a Zoom call with a law student at Ohio State, and they offered that for free and gave me very, very good advice. They helped me negotiate. Like you said, when we're planning for the unknown, it's looking for those key sections in that contract, in terms of a radius for non-compete. How long is that non-compete? What is your compensation, in terms of a daily minimum? And if you aren't hitting that daily minimum after, 90 days, are you going to have to pay that back out of future paychecks? These are all things as a new doctor, there were a lot of nuances, like you said, in that wording and that jargon, and that I may not have recognized on my own. So having somebody review those aspects with you, just to feel comfortable, like you said, not because you're planning ahead, like you want the best for this opportunity, but life changes and things happen. And so setting yourself up to feel comfortable from the beginning and having somebody who's qualified to review those things, I think that's really important.
Yeah, and it's really, again, it's just about, it's planning for the future. It's just going in. I don't think there's many things in life that we're not gonna prepare for. We're just kind of that way. Like we're very like, I need to kind of sort out my game plan before I jump into this. So it's almost like, are you ready to dive into the deep end of something, or do you want, to kind of step out from from the buoy to get into that zone? So I think that's a great point. Especially utilizing your resources on that.
Yeah, and then when you're ready to jump, when you're ready to make that jump, right? And the contract has been negotiated, you feel really good. Then what? What's the onboarding process like?
Exactly, and that's huge. I mean, once you kind of get all those like almost uncomfortable conversations out of the way, then how's the office going to support you? Then you're really talking about like, okay, the office that I'm currently with, they wanted my bio immediately. They wanted taking headshots immediately. I was on the website really the day I signed that contract. They already had everything ready to go. They already had printouts of who I am as a provider up front, even though I wasn't starting for like a month or so. They were introducing patients to me when I wasn't even there. Like all these things, they're thinking about how to implement me into the practice. They're thinking about how am I going to divide the exams up with this person? How am I going to put new patients in their schedule? That is like the ideal scenario when you're coming into an associateship. So I think if those things aren't there, maybe saying like, hey, how are you guys, maybe they don't mention it, you know what I mean? Like how are you guys promoting me? How long is it going to take me to get on the website? Some associates aren't on the website for a year. So how is someone gonna look up you and like, or if you're not, you don't even have business cards in the front of the office, like that's huge for knowing that like you're wanted in this practice and we're here to support you.
Well, Dr. Marsha, thank you for sharing, your journey in this process. This has been really helpful. I think we've given a lot of insights on what this process looks like in terms of finding a good practice, what red flags to look out for, what resources you need to review contracts. And I think that brings us into our next episode. Next week, we are focusing on practice longevity and from the aspect of health, wellness, and ergonomics. So I'm excited to see you back.
See you next week.
Thank you so much for listening. If you enjoyed this episode, please share it with a friend. Don't forget to leave us a comment, rate us, and subscribe so you never miss an episode. We appreciate your support and look forward to bringing you more great content.